Hello, I am Dr. Uday Kumar, and today I shall be speaking on the importance of home health care. Now, what exactly is home health care? Home health care is, as what the term defines, any medical care delivered to the patient at the patient's home. This could mean a visit of a doctor, of a nurse, a collection of a blood sample, or a physiotherapist visiting at home. So instead of taking this particular treatment in the hospital, home health care means that the whole treatment is shifted to a patient's home. This is exactly what we mean by home health care. I will try to define in this particular talk as to what is the significance of home care and what impact it has on the health of various people. Let's face it, healthcare today is very expensive. There are two kinds of expenses involved, what is called the visible cost and what is called the invisible cost. When you talk about the visible cost, we talk about going to a hospital, spending half a day there, spending money on investigations, on meeting the doctors, getting admitted, getting treated, medical bills and so on. All this will add up to quite a tidy sum of money. If we talk about invisible costs, I want to stress on the fact that no patient goes to the hospital alone. He has to have his son, his daughter, his attendant to go with him, and they are all leading productive lives. And they have to apply leave or take away time away from their work, and that also means cost in terms of man hours lost at work. Therefore, if you add the whole thing together, healthcare today is a pretty expensive business. Hospital medical care is also not a pleasant experience. It's a very slow process and an extremely stressful process. Because of various logistic concerns, no patient will be seen the moment he walks into a hospital. There is a process of registration, there is a process of waiting for the particular consultant, and after the consultant has seen the doctor, the patient may sometimes be wheeled into a laboratory for blood tests and once again get back to the patient's consultation, and then may be admitted, may not be admitted. A medication should be prescribed and the medicines have to be purchased at a pharmacy. The whole thing has to be checked, counter checked, bills have to be paid, and ultimately the patient is allowed to go home. The whole process, as you can imagine, can involve a lot of waiting, can involve a lot of stress. Therefore, hospital visit is definitely not a very pleasant experience. There are also a lot of challenges in accessibility. No hospital obviously is situated in the vicinity of a patient's home, and considering the heavy metropolis traffic we see in any city today, moving from the patient's home to the hospital and from the hospital to the patient's home back can be a major challenge in terms of access, in terms of encountering traffic and in terms of stress. Therefore, there is an added element of a problem of accessibility visiting a hospital for a health check, addressing various medical problems. In addition to all this, there is a major disparity in health statistics in our country. For example, there is only one bed for 10,000 patients in India, for example, or for that matter, any developing country. Ideally, this is not a good figure. The figures are far better than this, and there are about 0.7 to 0.9 hospital beds per 100 people of population in any developing country, like so in India. The ideal statistic or average statistic across the world is 3 beds per 1000 population. Therefore, you can imagine how skewed the statistics are in terms of medical care to the population at large. Home health care to a certain extent can repair this particular balance or offset this particular balance and make the statistics look a little better. This obviously is putting a lot of stress on the healthcare system. To add to this, there is the problem of personnel. Can you believe it? Today, the number of doctors required to our population should be more than double what is present now. The number of nurses required are 3 times more, and the number of paramedicals required to process our population is 4 times more. Therefore, we have woefully short in terms of manpower to deliver good medical care. Now look at certain of health outcomes delivered by home health care. In a hospital, whether you like it or not, even in the best of hospitals, there is an element of infection. In medical parlance, we call it nosocomial infection, or in common terms, it means hospital acquired infections. It's estimated that a third of the patients acquire infections in a hospital because of the hospital and not because of the illness. Therefore, this is a potent risk for hospitalization. It does not mean that nobody needs to get admitted, but admission time should be as brief as possible so that the exposure to nosocomial infections is minimized. There is also a lot of elegantly designed studies which show that home health care people heal faster. Maybe it's because of the environment at home, sleeping in their bed, living in a comfortable atmosphere with their loved dear ones around them. This will promote good health and faster healing. More importantly, home health care is a proactive business when compared to hospital care, which is a reactive business. Let me elaborate. If in case there is a one-to-one care of a patient at home, there is somebody monitoring the patient, and even before the patient sometimes can detect he has a problem, the caregiver can pick up something untoward and take action. Whereas you go to a hospital only when you have a symptom or when you have a problem, by which time it may be fairly advanced. Therefore, for very obvious reasons, home health care delivers better health outcomes compared to hospital care. There is also this element called readmissions. Just because we have home health care, it does not mean that we chase away all the hospital inpatients home because home health care is efficient. It's also important for us to know that readmissions back to hospital should be minimized. Therefore, an effective system would be a minimum hospital stay, early discharges, go home, take treatment there, and reduce the number of readmissions back to the hospital. This whole ideal situation would mean better health outcomes. Therefore, reduce hospital stay, decrease readmissions, promote good health. This is in essence the outcome of an ideal health system, and home care has a major part to play in this particular health system. Now, what does home health care mean in terms of reducing hospital stay or preventing hospital visits? You can imagine if in case you have to get a consultation done by a doctor, suppose you want to get a blood test done, suppose you want to discuss the blood test with a doctor, suppose you want physiotherapy done at home, and so on. The list is limitless, and in my estimate, 40% of footfalls what you see in hospitals can be eminently done at home. For example, somebody requires physiotherapy, there is no need for the patients to go every day over a span of 15, 20, 30 days to take physiotherapy in the hospital, where it can be done at home very, very efficiently. So also if somebody wants a blood test done, there is no need for a person to go to a laboratory or a hospital to get the blood test done and draw the blood sample. That is, this can be done at home. The blood sample can be processed in a laboratory. The reports can be sent to the doctor and the patient by various electronic methods like email or courier or whatever. The results can be interpreted, and if then required, the patient may go to a hospital. So in about 60 to 70% of people where blood tests can turn out to be normal, the whole process ends there. So also taking a small injection, an intramuscular injection, maybe a subcutaneous injection, this can be done at home without the patient have to budge from the comforts of his home. Therefore, we are adding to the reduction in traffic, to increasing the well-being of a patient and healing better at home. All these promote in very healthy outcomes, and there is an obvious advantage of home health care in this particular scenario. Home health care necessarily does not mean decreasing the revenues or footfalls in a hospital in terms of cost and efficiency. In fact, paradoxically enough, home health care makes hospital care even more efficient. Let me tell you how. Because the number of patients who are so-called visiting the hospital for very trivial reasons are eliminated, the hospital staff can focus on better care, better patient management, and more focused intensive therapies which a hospital is meant for, and not for very trivial reasons like a blood test or an OPD consult. Therefore, the efficiency of the hospital also will increase, the utilizations of the beds will increase, the turnover rate of a bed in a hospital increases, and thereby good care is given, good revenue is generated, and everybody, all the stakeholders are pretty happy about the outcome. Now, if I can summarize the advantages of home health care, Number one, there is an elective patient monitoring instead of a symptom based emergency outcome as you see in a hospital. It reduces thereby the number of complications, thereby increases the compliance and the adherence of a patient to medications and to treatment. This is specifically useful for elders and senior citizens who find moving out and in of hospitals a very cumbersome process, and in about 50% or 60% of these kind of chronic ailments, home health care will reduce the burden of the various logistics involved in hospital care to a great extent. So let me come to the brass tacks of what home health care can deliver. Now you might ask me, what do we do in home health care? We provide doctors at home, so a doctor can visit a patient at home on an elective basis, examine, talk to the patient, counsel the patient and give a prescription. We have nurses visiting the patient at home. The nurse can take care of the patient's movement, the arrangement of the bed, giving injections, giving enemas if required. All this can be done at home. Most importantly, I believe the important thing in home health care would be delivery of physiotherapy at home. You see, physiotherapy means that a patient has a physical disability, and to get restoration of function, he or she should go to hospital innumerable number of times to get the physiotherapy done. Instead, if the physiotherapist comes to the patient's home to deliver the same treatment, the movement of the patient is drastically reduced and thereby healing is better. Another segment where home health care delivers a good outcome is to deliver health attendants. There are a lot of elders and senior citizens who are not actually ill with an organic disease per se which will debilitate them, but they would require help with what is called the activities of daily living. This would mean taking a bath, wearing their clothes, getting onto the bed, getting off the bed, going for a walk around the house, reading, seeing television. These are kind of activities which they may not be able to manage on, but they do not have their attendants, their children or their siblings around them to help them. Therefore, having a long-term nursing attendant with them who will take care of their activities to daily living is a major impact we make in home health care provision, especially for senior citizens and elders who are otherwise healthy but because of their physical disability are unable to move as before. Like I mentioned some time ago, home healthcare also is a very good mechanism where blood samples and urine samples can be collected at periodic intervals for a chronically ill patient instead of a patient going to a laboratory, because the sample will be channelized to a laboratory and the laboratory will send the results back to the patient and the attender and the caregivers as the case may be. Home healthcare also makes the provision of providing health equipment to a patient at home. If somebody requires a special bed, a walker, a wheelchair, oxygen at home, oxygen concentrator at home, they did not run helter-skelter looking for these. A single umbrella of home health care provision takes care of a gamut of services of medical equipment delivered at the patient's home, serviced at the patient's home, and like in a hospital, patient is comfortably hooked on to whatever medical equipment he or she requires to be comfortable in as far as their health is concerned. To summarize about home health care, it has various levels of impact. Number one, from the patient point of view, there is obviously an improved access and convenience, and there is reduction in the number of hospital visits. As far as the hospital is concerned, we have better capacity utilization, early discharges, more throughput of patients. As far as the pharma is concerned, the prescription is channelized, delivered at home, no waiting times, and making sure that the right prescription reaches the right patient. And the most important impact would be on the insurance sector, where the expenditure or the payouts for various illnesses are drastically reduced because of the number of hospital days which are reduced, and home healthcare obviously will be cheaper compared to hospital healthcare, and therefore insurance also will be pretty pleased with the outcome of home healthcare. So this in essence is what home healthcare is all about. We are slowly changing the healthcare map of the world and of India towards delivering better healthcare to the patients, and the maximum impact is seen on our growing population of elders and senior citizens who otherwise would not have sought medical attention, and thanks to home health care, they are more into the mainstream of medicine, and their health care is in very good shape because there is somebody who is available at a phone call and will come home to deliver whatever care they require. Thank you very much. I am Dr. Uday Kumar from Portia Medical.